We believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome. My name is Donna Cryer. I'm the founder and CEO of the Global Liver Institute, and I have the privilege of being your host for GLI Live. Today is very special. It's part of our Donate Life series. Of course, as a liver transplant recipient of 29 years and counting, every month is Donate Life month for me. But I have with us a very special guest. I have Jennifer Erickson, who has just been such a warrior for organ donation and transplantation that I'm really excited to share her with you so that perhaps she can receive just a few of the many, many bouquets of flowers that she is owed for all of her hard work. She is a senior fellow of the Federation of American Scientists and a former assistant director for innovation and growth in the Obama White House. Welcome, Jennifer.
Thanks so much, Donna.
Excellent. So as we're introducing you to a larger audience, how did you become connected and passionate about the issue of organ donation and transplantation?
Well, I think like for a lot of us, it's personal, right? My father was, when I was in the White House, he was suffering from organ failure. His kidneys worked perfectly well until they had to be surgically removed, a result of his military service in Vietnam. And so seeing my father struggle with organ failure, seeing how grueling that life can be, I started looking around because I think like a lot of people in policy and politics, you start wondering, is this an N of one if something affects someone you love, or who else is going through this? And so that's when I really started connecting with other people in this space and trying to figure out how we could help more patients get the transplants they deserve.
And you certainly have been instrumental in doing that. This is an April like no other, because we have made such a breakthrough in reforming the organ procurement and transplant network. Can you tell us about the legislation first, and then we'll get into how that's being enacted?
Yes, well, I want to return the flowers and say thank you to you and GLI and all the patients who helped make this happen. So what we had happen last summer is Congress unanimously voted. People say Congress doesn't agree on anything. That's not true. They agree on this. They unanimously voted to empower the U.S. Department of Health and Human Services to break up the monopoly contract that has been responsible for mismanaging so many elements of organ donation for almost 40 years. So President Biden signed that into law. I know you were right there with him at the Oval
Very
Office.
Inconspicuously, keep the pen handy.
As always, yeah. No, but it is really exciting because, you know, you had Democrats and Republicans working together, listening to patients and saying, this isn't good enough. The system that was launched in the 1980s with such high hopes to serve donor families and patients on the waiting list just has not lived up to the mission. And we know that because according to peer-reviewed research, the lowest estimate of unrecovered, untransplanted organs every year is 28,000. So to make that real for a second, that's 17,500 kidneys. That's 7,500 livers, 1,500 hearts, 1,500 lungs. So, you know, there's Dr. Seth Karp, the surgeon in chief at Vanderbilt, who you testified alongside Donna at the House of Representatives. He has said, if you look at the math, there should not be a waiting list for livers, hearts, and lungs.
Particularly for livers. Yes, exactly.
Yeah, exactly. And so when you think about not just does someone get a transplant, but the grueling wait to find out if that's ever going to happen, and you realize there shouldn't be one because Americans are that generous. It is something we agree on as a country. 95% of Americans support organ donation. It literally pulls higher than ice cream and puppies. I checked. So we agree on this as a country. but we have been failed by a system of unaccountable contractors who just have never been held accountable by the federal government itself. And so that's what Congress has said it would change. And I know it might sound complicated. I also know a lot of your folks are super informed and educated on these issues. But I think the simple fact is this: Americans know monopolies don't work. And having a 40-year monopoly just has left too many of our friends and neighbors to suffer on the waiting list.
I will underscore that again, just in case it went by really quickly. 40, not just 4. There had been the same contractor having this monopoly for 40 years. And so, for many of us who have been through through transplantation or who are on the waiting list, we don't know about how the system as a whole works. You're just counting on the system to work like you and your father and your family were before you investigated. And yet when you and others, particularly in the Senate Finance Committee, investigated, they found so much wrong. Can you talk about the things that were documented and were found wrong, so people know why we had to fight so passionately for change?
Yeah, absolutely. Well, it all starts with donor families, right? And that incredibly generous decision that so many families make, often on the worst day of their lives when a loved one has been in an accident or suffered from some traumatic event, to say yes to organ donation.
Mhm.
And one of the things that Senate Finance investigated was just the fact that, again, so many organs from generous American organ donor families go unrecovered and untransplanted. And I know that's sort of hard to wrap our heads around, right? But what that means is quite literally the contractors that American taxpayers pay for often do not turn up to hospitals to have those conversations with families and recover those organs. And this is an area of major inequity as well, because we know from published research that organ contractors are only half as likely to turn up and talk to the family of a potential Black donor as a white donor. When they do, they spend less time, they respond with less compassion. And as a result, and for that reason, we see lower recovery rates from Black families across the country. It is not that they are less generous, it's they have less of an opportunity to donate. And not only is that hugely disrespectful to those families, but also same ethnicity matches are more likely. So if you're not talking to a donor family in Pittsburgh, you're absolutely hurting the next patient on the waiting list who might match in Newark or Philadelphia or New York or South Carolina, wherever that might be. So the first problem was organ procurement organizations, the contractors responsible at a local level, often not turning up, not doing the job. Also, and this is unimaginable to me, the federal government requires no clinical standards to recover organs. So Donna, I know you're a brilliant lawyer.
I remember the first time I saw that igloo cooler. I was just like, are we having a picnic? Are we transporting precious, biomaterial that will need to be carefully transported and placed back inside a human being? They had me at igloo cooler for one.
Right. So the lack of standards, and then one of the things that really came out is exactly what you're talking about, the technology around matching organs and also transporting them has been so antiquated as to be mind-blowing. I mean, when you testified for the Senate, there was a hearing a year before you testified where the surgeon in chief at University of Alabama, Birmingham, testified about receiving an organ in a cooler with tire marks on it. It had literally been run over. She received another organ that was frozen solid because it had been put in the wrong part of the plane, right? And so if you think about the harms there, right? Not only is that a terrible thing to do to a donor family, their loved one's final gift, but also to the patient who was on the operating table waiting. And I actually looked at the numbers right before this session. Last year in 2023 in the United States, we threw in the trash, more than 10,000 organs from organ donors and more than 1,000 livers.
So those are 10,000 lives that could be lived, 10,000 families restored, people going back to school like I did, going back to their families, and that should be a crime.
Yeah.
That should be a crime.
Yeah, and the thing is, this is fixable. You know, so many things in healthcare are really, really complicated, right?
Right.
Like, and the solutions might be very costly or very politically contentious. One of the reasons why this has brought together now 3 congressional investigations
Hmm.
from 3 different powerful congressional committees, and it's been
Right.
bipartisan along the way, is no one can be on the side of leaving human organs on the airport counter in Atlanta.
Right.
No one can be on the side of, this was another finding of Senate Finance, that the technology to match organs regularly goes down for up to hours at a time. Now think about, every organ is on a clock, right? To
Right.
get it to the recipient who desperately
Right.
needs it. And so, you know, here in the United States, like, we have the capacity to have IT systems that are truly up 24/7. We have the
Right.
capacity to move things around the country, even really, really sensitive things, and
Right.
not lose or damage them. It's just, we've never held that accountability to one of the most life and death areas imaginable in US healthcare.
And so now we have, or at least we thought we had, unanimous consent
Yep.
of Congress. And as I, spoke with, on this show, with Melissa Dickerson, who's an investigator for the Senate Finance Committee, who
Mhm.
was, part of the team, uncovering all of these facts and putting together, this case, that was so clear. We thought that by passing the legislation, but in a bipartisan way, with everyone's support, that would be the end of the story. We'd all get our pens from the bill signing and go home and focus on another issue. But that has not quite been the case. Why?
Well, there is an industry that is, many members are fighting back, and they're fighting for their lucrative government contracts and the status quo. And, you know, we've seen this when the federal government passed, again with GLI's help, thank you, first ever regulation to hold the local contractors accountable 4 years ago. And that this law to break up the national monopoly, it's been widely supported by patient groups. And then what we've seen is some forces for the status quo saying, hang on a second, basically spreading all sorts of scaremongering and fear tactics about what will happen with change. And, you know, you've said this so powerfully, right? A lot of patients, they don't fear changing the system. They fear the system staying the same. And let me make this real for a second. Right now, UNOS, the United Network for Organ Sharing, the contractor that holds the monopoly contract to manage the US organ donation system, is 15 times more likely to lose or damage an organ in transit than an airline is a suitcase. That is
And
not.
none of us even check our suitcases anymore because we're, so afraid they're gonna lose that. So if we don't trust the airline to get our, sundresses,
Right.
to the beach, in the same time, that we get there for our vacation, why would we trust someone who is 15 times less likely to do their job with something so precious?
Exactly. So the impetus for the law passing was very, very clear. To your point, now it's time for implementation. And that is really hard work and going up against some really entrenched interests. Forbes magazine called UNOS back in 1999 the cartel that's needlessly chilling the supply of the nation's organs and leaving Americans to die unnecessarily. That was 25 years ago. Right. And so I think, again, let's just go back to first principles. Monopolies are a terrible idea in general, and certainly for patients. And so we're now in that space where we are 9 months since the law passed, and the Health Resources Services Administration, or HRSA, they're the part of the federal government that gives out this contract. They are in the process of trying to break apart this monopoly in a way that truly serves patients. And, you know, if you think about all the different tasks of the national monopoly, whether that's the technology that matches a liver patient waiting in Washington, D.C. with the right match that's coming from Cincinnati, or the logistics, getting the organs where they need to go on time, or patient safety. Those are very different skills. And there
Right.
are definitely organizations in the United States that do them very well.
Mhm.
It's never, not in, as you said, 40 years, been able to compete for those contracts. So now is the time where it's really important for patients to stay loud. I hate that patients have to do so much of this work. I'm grateful that you and your colleagues do it so well, but to make sure that all of these changes are done with patients in mind.
And how can patients, get their voices heard, be part of this process? Are there comment opportunities, days on the Hill? How
Yeah.
can patients make sure that their voices are still heard? I'm still getting calls, so I know that there are patients who want to
Yeah.
make sure that this is done right. But how officially can we be a part?
Well, I mean, staying connected to GLI is one great way, because you all have been very clear about what still needs to happen to get this right. I would also say people can go, if they're interested, to organdonationreform.org. That has the basics of what Congress is up to, like a lot of federal data that's been made easier to understand what's going on. But it's always a good time to reach out. And again, I know GLI has great resources for this, to your representatives, and say this matters. I mean, people
Right.
as different as Senator Chuck Grassley and Senator Elizabeth Warren have all agreed on this, right? Like this is something we all agree on, but we have to see it through. And so for GLI members who are already in touch with their congressional representatives, or would like to be, then it's a great opportunity to say, see it through. Make sure that every one of these changes is done with patients in mind and not contractors.
And to put a little more precision on that, some of the things that we are trying to make sure happens are that the competition that was built into the legislation carries over into how the requests for proposals and the new contracts are written and awarded. Making sure that an independent board is actually independent and not just the same people who change the suit or go through a revolving door and end up back in charge again. And so these are the types of things that we are scrutinizing to make sure that this change is authentic on everyone's behalf. And so those are the points that we need to be reinforced and are on these websites and GLI letters that people can have access to, so they understand. And in countless Washington Post and other newspaper articles documenting this process all along. So you don't have to take our word for it. You can read the documents for yourself, be horrified, and then still call us and want to be a part. And one of the issues that we have been facing as we sort of carry on with this work, ensuring the integrity of the transplant system and access for everyone who needs a transplant, is the plight of Native Americans and the disparity that have been shown with Native Americans accessing transplantation and the Indian Health Service lack of resources to be able to support those. And so we want to see how we can help support the Indian Health Services and to make sure that our Native American friends are not, and families are not left out of this miracle while everyone else goes on with their lives. And so what can we still do to resolve disparities, which are a little different for different types of populations, and we see particularly that there are issues that stand out for Native American communities.
Right. It's a great point. And I think that another thing we can do is demand transparency from our federal government. The Department of Health and Human Services, when I mentioned that more than 10,000 organs, including 1,000 livers, were thrown away last year, they know when they were thrown away, where they were recovered. They have all that information literally every month. We should be able to see what happened in January, right? Like, it matters what you measure and what you put up sunlight, and we need to treat every one of those organs like the life and death issue that it is, right? These aren't just numbers, but we have to turn
Right.
on the lights to make sure we can actually follow the data and see what's going on. Similarly, I want to give credit to 6 organ procurement organizations that gave many years of their data to the Massachusetts Institute of Technology, MIT, and said, de-identify the data, open it on a public repository so everyone can see what's going on. And we can actually see where organs are lost in the process. And I mean that literally and figuratively, right? Like where cases aren't responded to. Are we being as equitable as we can be? I mean, Donna, you yourself spoke to the Associated Press several years ago
Right.
about an organ procurement organization not turning up in the case that in a case of your own father. I hope
Right.
you don't mind me saying that.
No. I didn't mean to gloss over it. It's just still so hard to process that, particularly because of having benefited from transplant. We were
Right.
keenly aware that organs can only be procured in a certain set of circumstances, and so making sure, as much as we were trying to keep my father alive, that we were doing things in a way that once he did pass, would preserve his organs. And so still to be told that we couldn't donate was really just devastating, is still just devastating to my
Right.
family.
Right. And so I think that, making sure that we know in the data, we're not just, don't just trust, verify, right?
Mm-hmm.
Are we treating Native American families the same way we're treating white families? Are we treating Black donor families the same way? Asian families, Hispanic families, right? Like we can see all of that in the data. And by treating them the same way, again, I'm talking about data points. Are organ procurement organizations responding as quickly? Are they responding as often? Right? All of these sorts of things we can see. And of course, there's issues with access to transplant as well. And I don't mean to gloss over that. I'm just saying, like, as we're thinking about Donate Life Month and organ donation, let's start by turning on the lights and making sure that we're treating donor families equitably, because that, I honestly believe, is the single most important thing we can do to help patients on the waiting list receive the organ transplants that they so desperately need.
Absolutely. And, effective advocacy is fueled by good data. And if we don't have the data, then we don't understand what programs would be helpful, where the needs are, where the gaps are, who is being underserved, and how. So we can, is it a transportation issue? Is it a referral issue? Is it the OPO issue, and their performance? And so unless we have the data that highlights the exact issue and the size and scale of the problem, we can address it with effective advocacy, because it's never going to be one size fits all. It has to be really targeted and appropriate to the state, to the population, and to the problem.
You're right.
So what does the future of organ donation and transplantation policy look like? Because we have had successes. We have had the rare X innovation. We have had a lot of things that people have waited a long time for in transplantation, and I think that brings the patient community together. We've certainly had some of our A3 advocates work on living donor legislation and ways to make sure that living donors don't have to sort of basically, pay for the privilege of donating an organ, that they're compensated in the right way. We know that there's lots to do on survivorship and equalizing how well people do after a transplant. So what does the future of transplant advocacy look like?
Well, I hope that it's a lot more accountable, that the U.S. organ donation system is a lot more accountable to the donor families and the patients who rely on it. And again, as you said, I think that starts with data. I think that includes basic elements of competition. I mean, our donor families and transplant patients should be served by the best of the best in every field, right? And we know that that's happening in so many ways. I mean, there are absolutely extraordinary things happening now in xenotransplants, in, care and ability to use organs that are HIV positive, hepatitis C positive, all of these advances that are happening. I have great faith in our scientists. I want to have great faith in our systems. And in order to do that, we need to turn on the lights. We need to follow the data and make sure that at every stage, the group that we're protecting are the patients themselves and not industry actors. I mean, there are a lot of people doing great things in organ transplant, but we just have to keep the main thing, right? And say, if people are doing the job and serving patients, great. They should keep doing it. And they should have to prove that year after year. And if they're not, they need to be replaced immediately by responsible, transparent entities that can serve patients.
I think we are also going to need a lot more patients and patient families, donors and donor families, to be able to sit on boards of OPOs, on the boards of hospitals that do transplants, in these committees that will be set up in these new and working with these new entities and hopefully new contractors as well, to make sure that they are informed as possible about what's needed from the lived experience, and that there's accountability at all levels. So I think we'll need more advocacy and more patients to step up and be part of the process that we're building for the future.
I think that's right, because it's patients and their caregivers and loved ones who can talk about not just how wonderful it is when things work, but how heartbreaking, terrifying, painful it is when things don't, right? And we need to tell every side of the story to make sure that it's working for everyone.
Absolutely. As GLI turns 10 years old this year, we're just reminded of the mission to make sure that all families were able to experience what mine did when all of the innovation and the parts of the system work well. And we know too many do not. And I couldn't in good conscience let that go without making it my full-time job plus. And so 10 years into this, I don't see the slowing down or the need for fewer patient voices or fewer or less oversight, only for more engagement. But I am excited that we've had partners like you in that engagement. So thank you, Jennifer, always. And thank you for explaining some of our work and the urgency to keep doing it today.
Thank you to you and every part of the GLI team and family for everything you all do every day. Sincerely.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.